Hello guys, welcome to my YouTube channel. Today I'll be teaching you guys on a common health condition known as hypertension, generally known as high blood pressure. Do you know that a huge number of people are not even aware that they have high blood pressure? Do you also know that this is one of the leading causes of death, of premature death worldwide? What is high blood pressure? What is this hypertension I'm talking about? High blood pressure simply means when the pressure in your blood vessels are too high, when they are above normal, which is when they are 140/90 or even higher. High blood pressure is a common condition, but if left untreated, it can be life-threatening. Most people with high blood pressure don't even have symptoms. They don't feel any symptoms, and they are not even aware that they are hypertensive. Some of the things that increases the risk of having high blood pressure. One of them is age. High blood pressure increases with age. It is more common in older age than in young age. Number two thing is genetics or family history. You might likely develop high blood pressure if any of your parents or siblings is hypertensive or have high blood pressure. Number three is being overweight or obese. Being overweight or obese can cause changes in the blood vessels, thereby leading to high blood pressure. Another thing that increases the risk of having high blood pressure is not physically active or not engaging in exercises. Now, not exercising can make you add a lot of weight, can increase your weight. Like I said before, increased weight can cause changes in the blood vessels, thereby leading to hypertension. Another thing that can increase the risk of having high blood pressure is high level of salt intake. When the level of sodium in your body is too high, this will cause the retention of fluid, leading to high blood pressure. Another thing that increases the risk of having high blood pressure is alcohol or tobacco intake or smoking. This causes changes in the blood vessels. It hardens or causes injuries in the blood vessels, thereby speeding the process of hardenings in the arteries, causing increase of your blood pressure. Another risk factor of having high blood pressure is low potassium level in the body. Potassium helps to balance the level of sodium, that's the level of salt in the body. An adequate level of potassium in the body is very important for a good heart health. So it is very important to eat food that are high in potassium. Now, another thing that increases the risk of having high blood pressure is stress. I know life itself is stressful, but you have to look for a way to adapt to stress. Yes, there are other medical conditions that can also increase the risk of having high blood pressure. Conditions like diabetes, conditions like other cardiovascular diseases, conditions like thyroid problems, conditions like adrenal gland tumors, conditions like chronic kidney disease, and lots of more. I'll be talking about some of the symptoms of high blood pressure. One of the best ways to know if you're hypertensive, if you're having high blood pressure, is for you to check your blood pressure. You mustn't wait to start having symptoms before you visit the hospital or before you seek medical care. Some of the symptoms of high blood pressure. 1. Headache. Another symptom is chest pain, confusion, anxiety, blurred vision or changes in your sight. There might be palpitation or irregular heart sounds. There might be difficulty in breathing. You might experience nosebleed. There might be confusion. I'm going to be talking about preventive measures or treatment of hypertension or high blood pressure. First of all, you have to live a healthy lifestyle. You have to eat right. What do I mean by eating right? You have to eat food that are low in sodium, food that are low in salt. You have to eat food that are low in saturated or trans fat. Food like your palm oil, food like your cheese, food like margarine, food like butter. You have to eat less of that. You have to eat Less of red meat, which is your cow meat. Eat more of the white meat, your chicken. Eat more of fish. Eat more of fruits. Eat more of vegetables. Less of carbohydrates and oil. It's going to help you a lot. Another preventive measure, you have to engage in exercises. You have to be physically active. You mustn't carry all the weight in the world. You mustn't go to the gym. A little walk every day for 15 minutes is going to help your heart beat. Another preventive measure is reduce stress. You have to rest more. Increase your intake of water. Another preventive measure, you have to say no to alcohol. You have to say no to smoking. You have to say no to tobacco intake. You have to say no to caffeinated drinks. Another way of treating or preventing high blood pressure is abide to your treatment if you are already diagnosed of hypertension. I'm talking about people that are already diagnosed, people that are already hypertensive. You have to adhere to your treatment regimen. Your follow-up visits, you have to go to the hospital when it's time for your follow-up visit. Now, lastly, I'll be talking about complication of high blood pressure. One of the complications of high blood pressure is heart failure, heart attack. There might be stroke, aneurysm, which can lead to death. It can lead to blindness or other eye problems. It can lead to confusion, inability to comprehend, inability to learn, inability to understand. Yes, high blood pressure can lead to kidney problems, kidney damage. High blood pressure can lead to stroke. So it is very important that you always check your blood pressure. It is very important that you always check your status, check your health. If you find this video very important, if you find this video useful, don't forget to like, subscribe, and share. Thank you.